Thousands of people are hastily leaving Victoria as the state's border closes amid a surging coronavirus outbreak. For the first time in more than 100 years, the border between the nation's two most populous states will close at midnight tonight. And South Australia is also considering stricter border measures.
It's all sparked by this, a soaring coronavirus infection rate. Victoria had its worst daily increase yesterday with 127 new cases recorded and 2 deaths. Frustration is growing in 9 inner-city public housing towers, forcibly locked down by authorities. Some residents say they've received very little food and are running short on daily supplies. Steph Ferrier is outside the tower blocks in North Melbourne, and Lily Mayers is following developments north of the border. Let's go straight to the towers. Steph, what are you seeing and hearing today from the plight of the residents?
Yes, good morning, PK. We can probably hear there's a very big booze bus here from the police that's just moving into position, and the police are all around here still patrolling this tower at North Melbourne. There's still a bit of frustration here amongst residents as they begin their third full day of hard lockdowns here now. Among the record 127 new cases across Victoria, 16 of them were picked up across 9 towers, both here and in Flemington in Melbourne's northwestern suburbs. There are another 10 previously detected cases that were also linked to the towers, bringing the cluster across these towers to 53 now. But of course, apart from all of the community outpouring of support and religious and multicultural groups banding together to prepare food and get them through, there's still been some delays with some of the deliveries. It's a bit hit and miss. Some people aren't getting food. We heard from one woman who lives in one of these apartments with her 7 children. Now, she had hardly any food when these lockdowns were announced, and it caught her unawares on Saturday evening. She waited all day and night, and the food finally arrived on Sunday at midnight. She opened her door to find a packet of soup and 5 meat pies to share between all of them. So she ended up going hungry and trying to feed her kids. So it's stories like this which have led to these increased frustrations, as well as the lack of communication. Earlier on, we heard from the federal Labor member for Wills, Peter Khalil, and that takes in some of these hotspot suburbs. And he said that he grew up in Housing Commission flats himself, and says that he's really concerned that these people were left as a bit of an afterthought, and perhaps the health authorities and governments should have been getting in contact with faith and multicultural leaders within these areas to help spread the message if and when an outbreak like this happened. Let's have a listen to what he had to say.
Where are the healthcare workers? Where are the social workers? Where's the mental health support? There's a big police presence, but what about all of that? And I don't say that just because I want to criticise any particular level of government. This is not a Labor or Liberal thing. It's a fact that people who live in housing commissions are often an afterthought, and it's not good enough.
Now, healthcare workers are still busy going door to door at these 9 housing towers, trying to test everybody for coronavirus. Health authorities say that they are expecting more cases to surface because of the crowded nature of these towers, as well as the communal areas. And they've set up a field hospital at Melbourne Showgrounds just as an acute care unit to help if any of these people get extra sick.
Steph, really quickly before we go to Lily, what are you seeing this morning insofar as food deliveries, if anything, and how are they getting up, or are people still being asked to come down, collect their packages?
Well, we haven't seen anything this morning, and as far as we're aware, some of them are being asked to come downstairs because they don't obviously want to send people in there into what they're classifying as a hot zone. Yeah,
OK, we'll wait to see how they keep doing that today. Thanks, Steph. Let's go to Lily in New South Wales. Residents trying to get back into New South Wales this morning ahead of that lockdown tonight. Lily, what's the big challenge here today?
Good morning, PK. Well, it's a huge job for authorities to monitor every access point into New South Wales. There's 55 ground crossings, 4 major highways, 33 bridges and waterways also. So logistically, it's a nightmare for authorities. They'll also be on standby to question travellers returning by air or by rail. And we've just seen the last XBT from Victoria into Sydney, from Melbourne to Sydney, arrive this morning. I spoke to some passengers and asked them what they thought to be on the last train from Victoria. Here's what a few had to say.
We're not not from Victoria, like we're not from there, so it was very scary. Yeah, but like it was all right.
How was it scary?
No, I was just scared like of getting COVID. So like yeah, but I did take precautions and stuff. So.
It was really unexpected. It's something that hasn't happened in over 100 years, and being involved in that, it's a really surreal experience. Visiting a friend, coming back, and it's just like, okay, the world's a bit different now.
And PK, the Albury-Wodonga border community has been on high alert since 2 people have tested positive to COVID-19 yesterday. The people that have had close contact with those 2 cases have been placed in self-isolation, and a testing clinic has been set up in the local community today. Authorities are urging anyone who has even mild symptoms to go and get tested.
Lily, thanks very much for the update there in Sydney, and Steph at North Melbourne outside those towers. We appreciate that.